We are neither nutritionists or medical providers. The topics discussed on this show are from our own research and experiences. Please consult your medical provider before attempting anything discussed on this show. Welcome to another episode of
Sjogren Strong. This is Brian.
And this is Lupe.
And this is your weekly podcast discussing how to live an active and healthy lifestyle despite a diagnosis of Sjogren syndrome.
We'd like to start off the show by thanking all our new followers and listeners and everybody in the Living Sjogren Strong community, all the new members.
And hats off to that community. It's awesome to see an alert come on my phone that somebody's posted something new. And by the time I get there, 3 or 4 people have commented, giving awesome advice and encouraging that individual with the question or comment. The community's only as strong as our weakest link, and we really don't have one right now. Everybody's doing a great job pitching in and taking care of one another in Living Sjogren Strong.
I love it. That's what we wanted, and that's what...
Her hands are circling. She's waxing on, waxing off.
I'm trying to find the right word, but sometimes words just escape me. It's awesome. For those following on Instagram, you know that I've been posting a lot about my teeth. I think I have like 3 or 4 posts about my teeth. So a few episodes ago, I said that I had found a couple of cavities, which turned out not to be cavities at all.
Yeah, it ended up being just a little buildup, right?
Yep, which I've never experienced before because I am a super freak when it comes to my teeth. And I always brush and floss, but apparently I hadn't been doing that too well.
Which teeth do you floss?
Only the ones I want to keep. All of them. Actually, that's really funny because when I was younger, I went to the dentist and they're like, oh, you have to floss your teeth. Do I have to floss all of them? Nope. Just the ones you want to keep. But apparently I wasn't doing a good job because I got buildup or whatever it is that I thought were cavities. But that's all gone. My pearly whites are back, except for that big time infection on one of my molars.
So over the course of the past few days, we've been diving into a lot of oral care issues, and we actually identified some things that needed to be fixed within the house, within habits. And we wanted to talk this week about that. For example, she has a water pick that she utilizes to help clean her teeth. And she says, hey, the battery's not keeping a charge any longer. Can we get a new one?
And he says, sure, why not?
So we go get a new one. And not only was the battery not keeping a charge, but the pump pushing the water through it was also decreasing in power. So she turns this thing on, starts squirting in her mouth, and...
magic.
There was so much more pressure than she had been used to. And the pressure had gradually reduced over time that it wasn't noticeable.
So let me back it up a little bit, Brian. I went to the dentist on Tuesday, which is last Tuesday. The dentist is like, oh, don't worry about it. You know, what I thought was cavity, that'll be gone before you leave the office, which I was really excited about. But one of my molars, I think the infection has been stewing for a long time because I think a couple of visits ago, she told me, you need to have that checked. And I'm thinking to myself, well, it doesn't hurt. Nothing's going on that I know of.
She took a page out of my playbook.
So I didn't do anything with it. And it still doesn't hurt. The molar she was talking about doesn't hurt. She took x-rays. And she said, you need to go see a specialist, which they have at that same office on Saturdays only. So she said, we're going to make you an appointment with the specialist and you need to come back because I'm pretty positive that that tooth needs to be extracted. And I'm like, I almost canceled the appointment, guys. But I already had it. So I thought, you know what? I'm just going to go as soon as the specialist saw it. I don't know what kind of specialist it's called. So let's just call him a doc. And he says that tooth needs to be pulled, but he wanted me to take a 3D x-ray, which was pretty cool, guys. They put me like just my head in this contraption thing, and it spun around my head, taking a 3D image.
And you can even see her earrings.
Oh, shoot. They told me, just take the hoops out. No need to take the diamond studs out that I wear. And I said, well, I'm wearing bobby pins. Do I need to take those out? And he's like, don't worry about it. Only if your head explodes, then we'll know. And I said, oh my God, if my head explodes, please take a video so I could post it.
No video of head exploding.
It didn't explode. But anyways, they took the 3D x-rays and the doctor came back and he said, we can't save it. It needs to be extracted. And I said, why? And he said, well, the crown looks pretty good. They did a really good job, but the root is broken. And I told him, well, why don't you just fix it and seal it? We don't need to pull it. But I guess it doesn't work that way.
And that's why Lupe is not a dentist.
Come on, guys. I've never had a tooth extracted, so I was a little bit bummed, but I didn't cry. No more crying for me. This is what he said to me. He said, well, your tooth, it's still pretty affected, so I'm going to give you another round of antibiotics. And I said, Doc, no need to do that because I didn't even start the first round.
Bad patient.
Because it didn't hurt. And so...
Because she's smarter than the dentist.
That's right. I'm smarter. It didn't hurt. I didn't take the antibiotics, but mainly I didn't take them because those things were huge. Big horse pills.
So if you've been listening a while, we know she has an issue swallowing pills. And she has a pill grinder and a pill splitter. And yes, she did not cry, but she came home acting like a little baby. Will you please make my medicine? I'm like, really? You know how to grind pills. And just put a little orange juice in it, shoot it, and chase it with some more orange juice, and you're golden.
Some pills just taste nasty, especially antibiotics.
So I grind this massive pill up.
Horse pill. And it's 1,000 milligrams, so you know it's big.
And it's amoxicillin, correct?
Yes, and I'm sorry, not milligrams, mgs.
That's milligrams.
Oh, okay. I'm not a whatever either.
Pharmacist. We need Dr. Wong back on the show.
Yeah.
So I grind this thing up and I grind it really, really good. I want it nice and fine so it dissolves pretty well in the orange juice. We have a little shot glass. Add just half of an ounce of orange juice in it. Stir it and stir it and stir it. And it's this orangey, milky looking stuff. It's no clumps in it. It's pretty much all liquid at this point. And I'm like, there you go. Take it. She's like, oh, I don't want to. I'm like, oh my goodness. Quit acting like a baby and take your meds.
Because I was expecting it to taste just nasty and make me want to puke.
And how did it taste in the orange juice?
And you didn't even add sugar. I asked you to add sugar and you didn't.
Because there's enough acid and enough sugar in the orange juice. I said, try it.
Long story short, it didn't taste bad at all. And I'm sorry I didn't take it sooner. I'm embarrassed. This is my embarrassed face.
So you've been faithfully taking the meds for a couple of days.
So I started yesterday, 2 days. And you know what? The infection has gone down significantly to where the side of my face on the right side, it was starting to swell up a little bit because I know we're not symmetrical, but it was kind of out there. I'm like, what's going on with my face? Maybe it was the inflammation that I was talking about, right? But actually the gums have gone down so much. It's going back to normal, so... Oh my goodness, an infection. But the problem is that didn't hurt. So how could I have an infection if it doesn't hurt? That was my train of thought anyways.
This whole thing has brought up the point that we need to take a peek at what we're doing for our oral hygiene. And we went back and we reviewed some notes. And the first thing that I think is funny, they say brush and floss twice a day. And then later on, brush and floss after every meal. So is that 5 times a day?
Do you eat 5 times a day?
Well, it says twice a day and then after every meal. That'd be 5 times a day.
I don't think you could floss or brush too much, can you?
Apparently not. In addition to brushing and flossing, the toothpaste that is used for those of us with Sjogren's should have fluoride, should not be whitening or a smoker's toothpaste. We do not want toothpaste with sodium lauryl sulfate in it because it can dry your mouth out and exacerbate the dry mouth.
Random. What is smoker's toothpaste? For smokers?
Yeah, it's a toothpaste developed for smokers to mask the scent of the smoke.
Didn't know that was a thing, but so to brush my teeth, I use Biotin. That works well for me. I've run out sometimes and I use Brian's toothpaste and it really burns my gums, my tongue, my mouth. It just burns.
I like mint.
You know what? I read that you shouldn't use minty toothpaste. And that came from that website we were on. I forget.
It was the John Hopkins Sjogren's Center website.
I did not know that. I personally don't prefer mint. I just like the regular one. But it was interesting to see that because a lot of people that I've been talking to via social media, they don't prefer mint either.
So in addition to all of that, they recommend talking to your dentist about a prescription fluoride toothpaste and or fluoride treatments while you are in the office.
I want to say something about that. I've been to 2 dentists probably in the past 10 years because I like sticking with the same dentist. And but the one that I had many years ago, I asked about fluoride toothpaste or a fluoride treatment. And they said, it's really expensive to get a prescription. Just buy Colgate or whatever it was they told me at the time to buy. And they said just to make sure it has fluoride. This dentist that I went to on Saturday, I said the same thing. And they said they don't do that. Just make sure to buy toothpaste with fluoride, which I thought was weird, but okay. I mean, they're the experts, right? So I just said, okay.
In addition to the fluoride treatment, having dry mouth promotes an unhealthy mouth. So it can increase tooth decay and issues with your gums and bad breath and all of that. So utilizing lozenges, gums, sprays, oral rinses for dry mouth will combat this and help keep the teeth nice and clean and your mouth moist. And in addition to that, recommended were diabetic candies or dietetic candies. So these are sugar-free, hard candies that can be used as a lozenger, and them being sugar-free are going to help keep the teeth nice and clean and reduce the calories from these candies throughout the day.
I want to talk about those lozenges. I've bought ACT lozenges and I recently bought Biotin lozenges and even like cough drops that claim not to have sugar. I mean, I don't taste the sugar, but I feel like when I have the lozenges in my mouth or the cough drops, I can feel something sticky in my mouth because I don't produce saliva. And I don't know what it is. So I prefer not to use them because I don't like that feeling.
And I think it's the sorbitol. And I think it's just something that you need to get used to because it's supposed to coat the mouth.
Okay, because that's what I feel. I feel it's coating it with something sticky. Or maybe I'm not used to saliva anymore. So that's why
it feels different and awkward.
Yeah. But I'll give it a shot.
In addition to all of this, like I said at the beginning of the show, we've reintroduced a new water pick.
I love this water pick. I think for a while there, I kind of stopped using it. But since all these problems started, I mean, I thought I was taking really good care of my teeth and my gums and my mouth, but apparently not. So when I noticed that my water pick wasn't keeping a charge, we actually went over the weekend and bought a new one. And this thing is so powerful. I'm sorry I stopped using it, that I waited so long.
What brand was it?
I think that's the brand Water Pick. And we got it at Target for like
$35, $40?
$40 because we had gone to Costco and they had like this dual electric one and cordless one. And I'm thinking, well, I don't need 2. Why do I need 2? So I just went to Target and bought the one I needed.
Right, which is the exact same model that you had. So.
Yes.
And it comes with 4 different tips. Some have bristles on them, so you can kind of get in and massage the gums while it's irrigating or rinsing the gums out.
Or if you have braces.
Yeah. Good pull. That's probably what it was designed for.
Yeah.
It's fun to grab and shoot her with it.
He did do that.
I can't wait for the dogs to come watch. See how they like it.
I even hid behind the shower curtain, but it was funny. Going back to whitening your teeth or using the toothpaste, I haven't in a while, but because I do like taking care of my teeth, I do use those whitening strips. And those don't seem to be as harsh on your gums or your teeth as the toothpaste, because a few months ago, I did notice that my teeth weren't as white as they used to be or as I like them to be. And I did buy a whitening toothpaste, and I noticed that my gums, my mouth was so dry, and I just could not put my finger on it until the last time that I used it, and I realized, oh my gosh, it's this toothpaste that's making my mouth drier. So I actually stopped using it.
And I think if you went back to the strips and utilized the strips, but when you remove the strips, rinse your mouth out really good, and then utilize moisten to coat your mouth and get a lozenger in right away to help combat the drying effects of the whitening strips.
Yeah. I think mainly it was the toothpaste. The strips,
not so bad.
I haven't used them in a while, but I think they were okay.
Awesome. And then in addition to that, something we're actually going to do once we hit stop recording on this episode is we're going to go back to either Target or Walmart and purchase a new electric toothbrush.
It's going to be Target. You know why?
Probably because there's a piece of clothing you want that you saw and they didn't have the color you wanted at the Target you were at.
Exactly. They only had pink and canary, and I actually want a green one.
And if you wear OD green clothing, it helps promote healthy mouth.
He's just being funny. But yeah, you know what? Now that you mention it, it's true. So I have to get it. So
doctor prescribed. And I think it's just the contrast between OD green and white teeth.
I think you all should do that.
All right. So again, oral care, it's obviously important. The last support group we were at, there were people there that were talking about the dental issues that they have and how bad they were, and that tooth loss can become an issue. And we're trying to do everything we can to curb that with Lupe.
You know what? I didn't think that my teeth were so bad. But now that I think about it, I actually have 2 crowns. And I've had them for about maybe 8 to 10 years. And hindsight, it was probably dry mouth that I didn't know about. But I'm definitely doing everything that I can. I wanted to talk about one more thing. The website that we were on, they were talking about cavities, and it was talking about how to prevent them. And it said something about if you're at risk for cavities, you should rinse your mouth with mouthwash 1 to 2 minutes right before your bedtime, which usually they don't encourage. But again, if you're at risk for cavities, 1 to 2 minutes before bedtime. So I'm going to start doing that too, if I don't fall asleep before, which I probably will. So
for those of you that are wondering about the posts that she's been posting regarding her dental care, we kind of tend to post different things on the different social media platforms. So a lot of the day-to-day and what she's actually going through is on Instagram. So if you do not follow us on Instagram, go hit us up. We are at Sjogren Strong. And or Facebook, we are Sjogren Strong, and we have a Facebook group called Living Sjogren Strong. You're welcome to join that group and follow us there. And let me caution you, if you join the group, a couple of questions are going to pop up. If you do not answer the questions, you will not get into the group. So please, if you take the time to go to the group and say, join the group, just take a couple of seconds to answer these questions so we can ensure that you're a great fit for the group.
And about Facebook, I tend not to post the day-to-day on Facebook because, I don't know, part of me feels that that's not what people want to see on Facebook. They want to see tips and tricks and what helps. And I don't know if that's the right thing to post on Facebook. But if you only follow us on Facebook and you would like me to start posting about my day-to-day life, what I'm going through with Sjogrens, if you could send a private message via Facebook just let me know, and I will definitely start posting about it.
Yeah, and last week's episode, Consider the Source. If you did not hear that, please go back and listen to last week's episode. The information we utilized for this week's episode was found on the John Hopkins Sjogren's Center's website, and there will be a link to that in the show notes, along with a link to join Team Living Sjogren Strong to support the 2019 LA Area Walk for Sjogrens. Please, if you're local, join us. If you're not local, support us. If you would like a walk in your area, shoot us a private message and let us know, and we will put you in touch with the people at the foundation that can help you start a walk for Sjogrens in your area.
Absolutely. As we mentioned last week, a lot of people are hitting us up and asking us to come to where they're at and do a walk. So again, we're definitely going to pass that along to the foundation. So to end this, take care of your teeth, take care of your mouth. You only have this set for the rest of your life. Take care of them. Until next time, sip constantly and stay hydrated.